Welcome back to the Progressive Rehab and Strength Podcast. This is a 10-minute tip Tuesday. I haven't set the timer. You know what? I'm not going to set it. This is just a Tuesday episode because it's not really a tip. What we're doing is talking about an interesting phenomenon that we see in barbell training injuries. So we're just going to discuss it to give athletes, coaches, and clinicians some insight into what we've seen, and kind of discuss if we should address these things before we see them or not. So this episode, what we're talking about is the relationship between shoulder tightness in the squat and injuries to the opposite adductor inner thigh or groin in the lower extremity, opposite to the shoulder that someone is experiencing tightness in. Now, I've had 3 specific cases that were extreme of this, and they all came to me. One of them came to me very specifically after they tore their adductor. And in my evaluation of this client, I learned that on the opposite side, in their shoulder, where the bar sits, they had a grade 2 ulcer. Or maybe even grade 3, I can't remember, to the point where the bar had, we've all heard of bar bite. So that's when we get skin scraping or like some irritation or even like loss of skin under where the bar sits on our back. And this person had such a bad ulcer or abrasion. They're called ulcers at that point when you start to see like muscle and fascia and bone. And this person, I cannot remember because it was so long ago, if this person had just muscle exposed or a little bit of bone also exposed. Then this person really should have addressed that before it got to that point. But they didn't. But they did treat it medically with the appropriate things. And that's, you need a wound doctor or a wound specialist to treat it at that point. There's special wound medication that you need. And then that person ended up having a full tear with retraction of their adductor muscle. So one of their inner thigh muscles. And so that was one incident. That was the first extreme case of this that I've seen. I helped them with that rehabilitation process for their adductor. And then another one of my clients who was a coaching client of mine who had various injuries. And generally speaking, the clients that we have at PRS come to us because of injuries that they have, and then they stick with us for coaching after that. So this person probably came to me. I can't even remember. I worked with this client for so long. Don't remember what the first reason for coming to me was, but, worked with me online most of the time, came to see me in person every so often. And I noticed that his shoulder was bleeding while we were squatting together. And I was like, oh, that's interesting. And we were dealing at the time with an adductor strain. That's why he was coming to see me. And I was like, dude, like, how often does this happen? He goes, oh, all the time, just a little blood. I was like, oh, okay. Well, why are we bleeding? Like, what is it about that side that is leading that side to bleed? And, going on there. And then another one of my clients who came to me originally because of a shoulder issue, trying to avoid shoulder surgery. She was training for the world championships, and on route to training throughout that process, she ended up with a probably grade 2, like early grade 3 adductor tear. And it was, related to the tightness that she was experiencing in the opposite shoulder. So this is something that I've seen quite a bit. My husband, John, even deals with a very tight shoulder on one side and a chronic adductor strain on the opposite side. And Alyssa, you deal with something similar. So tell us a little bit about what you deal with.
Yeah. And I think my situation is probably less extreme than what you've described, partly because I'm pretty aware of it and we'll get on top of it. So my left shoulder is a bit tighter than my right. And I can see that in, my bar placement where my elbow is for squat. And just over the years, I end up with these small, when I say adductor strains, it's like, well, I strained my adductor, but usually not something that is going to interfere with what I'm doing. It typically doesn't stop me from lifting, but I'm very aware of it. And it will resolve quickly. I do pay a good amount of attention as to what's happening with my bar for squat, where I'm placing it. But the other complication that I can run into is sometimes if I try to make sure I'm perfectly even, then my right lower back and my left anterior hip become unhappy. So I have to find that kind of middle ground of asymmetry where it's like, okay, this is the asymmetry that my body has been dealt. And this is what I can handle to feel good, but not so much that I am like tweaking or straining my right adductor. And it's not usually, they're not typically, well, it's not all the time a training related strain, but I still, sometimes it can happen when I'm training, or I can feel it when I'm training, but sometimes I don't even know how it's happened.
Just creeps up on you. I mean, but sometimes I think, we were just recording my episode about my injury, is that like sometimes maybe we don't even like, it's so nothing almost to us. Like it's, maybe we have a high pain tolerance, or we don't notice it, or it's like, oh, that's like barely anything. But it's how many times can you say that's like barely anything, and then it's something,
yeah. So, it probably, that's likely what sort of sets things off. And then, I kind of strained it a few weeks ago, giving a hand off on bench, like, because it's always something.
It's always something
silly. But yeah, I mean, that's been going on for years. And my left shoulder has always been my left shoulder.
And I think, so it's interesting what you said is, why it's never gotten to that extreme is because you're very aware of it, and I think, for the case of those two guys that I brought as examples, we shouldn't ignore skin abrasions, because in barbell training, if you are getting not calluses aren't skin abrasions. Calluses, especially calluses on like your hands that are even, so we have the same calluses on both hands. We should have the same calluses on both hands, and we should have the same, if we get markings from the bar, we shouldn't be getting markings from the bar on our body. Like we shouldn't have scabs or bleeding or anything. But if they're even and they're both sides, like that's a little bit better than things just being on one side. So I guess if we're trying to turn this into a 10-minute tip, the tip here is that if you are seeing that your skin is abrasing and you're getting some type of scab or callus on your shoulder, or more of a callus on one side than the other, in your squat, like where the squat bar sits on your back, or you're bleeding, or, now you're bleeding and you weren't the last couple of weeks, like what's going on, and how can we change this so that this doesn't happen? And if you are bleeding and you have abrased your skin, you've got to get the bar off of it so it heals. Because if we don't let it heal, we're going to start to compensate in other ways for that issue, that open wound on our back. And that can lead to, taking more of the load on the opposite side, ending up with an adductor issue or tear. And I think, so it's kind of twofold. It's, if we notice this is starting to happen and we've got a scab or a callus on one shoulder, or we're getting some like shoulder tightness on one side of the squat, we should figure it out. But not to the point where, Alyssa, like you said, you don't want to overcorrect in asymmetry such that it causes another issue in your body, And we've talked about this. I think we definitely talked about it in the hip functional anatomy episode, like how much, like it's okay to be asymmetric, but we've got to find that happy medium, or that happy balance of like, what is your normal, your asymmetric normal, versus what's a potential risk for injury in any capacity, right? So if you're starting to see these scabs or calluses asymmetrically developed, then we've got to get off, like decrease the pressure on the shoulder so that that wound heals. If you're bleeding, if there's open skin, get the bar off that spot, like now. Like just take that seriously, because the last thing we need is infection. The gym equipment, I'm sorry, is not clean. No matter how much you clean it, like it's not clean, you know?
And like the bar, okay, even if you have a bar at your house and you're the only one using it, I mean,
It's
you should be
metal.
oiling it. I'm
Yeah. And
certainly not disinfecting
right.
my
Chalk, oil.
bar. So yeah, I wouldn't want that in an open wound. So like there's that aspect of it, and paying attention to what's going on and why it's happening, like how you're getting to that point, because it might not just be that you need to push the bar into your other shoulder more so that you're, there's probably something else going on, or maybe the bar is rolling on one side because of tightness in that shoulder. We really don't want symmetrical wounds from the bar either.
Right. Yes.
Because that means the bar is moving and it shouldn't be. But like you said, Rory, of more concern. Yeah, of more concern is an asymmetrical wound. But we're all asymmetrical. So the question becomes sort of finding that balance between, all right, can we not break our skin, improve symmetry to either reduce symptoms that are there, or that, could potentially occur, but not get to a point that you're like, that's great if you make yourself look really, really even and your bar is finally level. But in my case, to me, that means my old left anterior hip symptoms will start talking to me. So, and actually my mom was here today, and I was squatting, and she goes, I never noticed this, but do you know your right side of the bar, your right side's lower? And I said, yeah, I'm uneven, just like everybody else.
My right
and
side
you
is lower too.
And it's not so much that, like, when I'm standing, it's fine. It's as I move, but and for me, fixing that results in other problems. So it's really just having an understanding of like where you should be, and not necessarily aiming for perfectly even, because we are not perfectly even. But also, if someone does have an adductor symptoms or strain, it doesn't have to be, like a full tear of an adductor. If you're constantly feeling like you're tweaking your adductor or something's going on, it might not be as simple as, oh, you just need to like not let your knees come in, right? Like, or just look at the hips. Let's look at the whole picture.
Yes.
We always want to see what's going on up top.
And I think that, the lesson I learned from these two clients was that I need to look at, we know that we look at shoulder, we look at hip height, we look at shoulder height, it doesn't matter what part of the body. I could be looking at your ankle and I'm going to look at you from head to toe, But one thing that these two clients taught me when I started to see this happen was that I've got to take their shirts off and look at their skin, because when you're dealing with asymmetrical hip injuries or asymmetrical shoulder injuries, which usually we have one side injured. It's not usually both sides, we need to, where the bar is contacting the body, we've got to look at it and see how is that bar contacting the body. So for anything related to the squat, whether it's the hip, the shoulder, the ankle, like we've got to look at the shoulders without the shirt on and see how the bar is callousing their back. The other thing also is, just from like a deadlift perspective, you want to look at their shins as well and look at, is the bar hitting one side? Are they like, what's going on with their shins too? So I always will look at, male or female, I will have them take their shirt off and look at how their back is callousing from the bar. And that's for any part of the body when we're evaluating them. You looked like you had something to say.
Well, yeah. And sometimes, it doesn't have to be this obvious, like, open wound on someone's back. So you might ask somebody, are you getting like are you getting scabs or wounds? Are you bleeding from the bar? And they might say no, not because they're lying. They might not be aware.
Yeah.
You know, like sort of that dry, callousy skin
Mm-hmm,
is
mm-hmm.
also fair game.
Yeah,
And, you
John
know,
gets that on his shoulders, and he gets it on one side more than the other too. And that's totally true. Is that it doesn't have to be like this extreme that we're talking about. We don't want it to get to the extreme. So as a coach, a clinician, or an athlete, like look at your shoulders, and if you're like super excited, like I see people posting on social media. I mean, it's less now than it was in the past, but they get so excited about their bar bite. Like, you don't want bar bite on your back. That means the bar is rolling.
yeah. Yeah. And I think, you know, with deadlift, especially, I think majority of people are using a mixed grip. And that's
Mm-hmm.
where, you know, it doesn't have to mean that you have an asymmetry in your shoulders, but you're holding the bar asymmetrically. So that is where we often do see a bar not touching one shin or touch
Mm-hmm.
and touching the other. And, you know, sometimes it's just a matter of being aware of it and pulling one side in, because usually that overhand wants to run
Get away.
away.
Yeah.
um,
And then, in terms of, so we're seeing, just kind of going back to the statement where you said, well, you're like aware of it, so you don't ever get these like full blown issues, and I think that's key. Like we've got to adjust and identify, why are we getting this skin issue from the bar? And is it just that the bar is rolling? What does it mean for the rest of the kinetic chain, the body barbell system? When we have pain or skin irritation, or tightness in the shoulder, we see offloading to the other shoulder, which means that the other side of the body is taking more of a hit. And that's kind of where we see these adductor strains come from. Not all adductor strains are related to the shoulder, but we can't forget about it, and we can't rule it out. We can't say, oh, it's like, just your load, or it's your knee cave, or it's your foot, it's your ankle. Like, no, it could be the shoulder.
yeah. And I've had clients who wanted to ask me about a hip shift and sent me sort of a waist down video. And I'm like, I can't speak on this yet.
I know. So, I guess that's pretty much it. We just wanted to bring your attention to it, because I don't think that a lot of people are aware of this. It's not really talked about. I've never seen it talked about anywhere else other than within my little clinical network, when I'm talking to people about this like crazy crap that I saw in the past. Like, I'm always like shocked, and I've wanted to do like case studies on it, although they're such old cases of mine that I don't know if I have like all the information to write up case studies on these. But it's just like something we wanted to bring your attention to as a clinician or coach. Incorporate this into your evaluation of hip and adductor issues. As an athlete, just be super aware of, if you are starting to see a callus develop on one side, or you do have shoulder tightness in one side, or you're getting any bleeding, offload that and address that issue, because the more you let that continue to happen, the more you're going to offload the bar onto the opposite side and be at higher risk for an injury somewhere else. So that is our 10-minute tip Tuesday: the relationship between adductor strains and shoulder tightness of the opposite side. All right, guys, bye for now.